And we ask ourselves, what would it take, was it even possible, to transform a maternity campus into an ICU-level hospital, a hospital where every patient had a negative pressure environment, access to advanced critical care treatment modalities, and also an environment that would support the safety and well-being of our staff. And this is our story.
We weren't sure how we should use this building. So we went on a tour, and it was a very unusual, kind of weird experience, a mystic experience, you might say, when I walked into the ICU, because it was obvious that this was exactly what we needed in our community.
We creatively came up with a way to make the entire unit negative pressure, not room by room, but the full unit. This was a breakthrough. It was a breakthrough that allowed staff to move freely within the unit. They could save PPE and allow staff to do the work for very contagious, very sick patients.
Our teams use something that we call extended PPE, so extended personal protective equipment. So they wear their PPE for a longer period of time than we would be able to if we were not in a COVID-only facility. This allows for efficiency in PPE usage. We are able to conserve our PPE much better. It keeps our staff safer because they don't have to don and doff after every entrance into the patient's room. So on a normal campus, just to give a patient a cup of water, you would have to don PPE, and when you come out of that room, you'd have to take everything off. In this setting, we're able to wear our PPE for an extended period of time, which reduces the number of times that staff have to come out of the PPE, which every time they come out, it increases the risk for exposure.
We looked for innovative ways to build an environment that would meet the needs of our staff in a very unique, succinct way. So we partnered our lean team and our infection prevention team together, and we asked them to develop pathways throughout the units and throughout the campus that would not only save steps to make them more efficient, but would allow the placement of equipment and supplies so there would be fewer touch points in a contaminated environment. Small things like taking all the locks and the doorknobs off of doors and adding wave plates so that staff, without touching an environment, could move freely within and without the care area.
What we really, really wanted, the two priorities were, we want this to be the safest place in our city. And then two, we wanted to be right there with the patients. We wanted to be able to stand beside them for hours. We wanted to be able to care for them in the same way that we had been for decades here, despite the need for PPE and physical barriers.
In order to make sure that we were able to keep our employees safe, we have established cold zones and hot zones so that we're able to separate and have areas where staff are able to work in a safe environment.
At the outset, we realized that it was incredibly important to create a facility where our staff felt safe. We needed clean entrances for staff. We needed health checks on the way in. We needed to make sure everyone was wearing a mask, washing their hands. And I'm very happy to say that I hear that over and over and over again.